I'm the director of the Women's Heart Center, as well as the director of the non-invasive cardiac imaging at Deborah. I have a special interest in women's heart health, but I do see all adult patients who come in with heart disease. Ahead of the visit, ask yourself, what are my goals for this visit? What do I want the doctor to address for this visit? Also, have an open mind in terms of treatment. I know many times patients come in with lots of information that they hear from the internet, from the TV. They heard that this is not good, that's not good. Let's have a discussion about it. One of my things I always ask my patients is, do you have my business card? Because that's very important, because the visit does not end at when that patient walks out of the door. Regardless of whatever else is going on in the environment around you, there's still that patient-physician interaction that is vital, and that's something I just cherish. My dad actually is a physician, so he still practices back home in Jamaica. I grew up and I saw how he went out to work every day and made people feel well. That's what really drew me into this field. I couldn't see myself doing anything else. I actually entered my first month being pregnant with my first child, so I actually got introduced to the Echo Lab a month before that. What drew me to that area was just the ability to just see the heart in so many different dimensions. You can use an ultrasound to take a picture of the heart. You can use nuclear imaging to look at blood supply to the heart. You can also look at a CAT scan and just look at blood vessels, and that's something that you couldn't do 30 years ago, to actually look at a picture of a blood vessel in someone's heart without having to open and put catheters up there. I thought that was just phenomenal. Patients, I think, appreciate the history of just Deborah not billing patients, and know that you're not in it for the money. You're in it because you want to be here and take care of the patient. I think that first and foremost is what drew me to the hospital, and I think that's what keeps me here. Just the level of gratitude that the patients have. And it has nothing to do with me being the physician and that person being the patient. I think I look at all of us as being human beings, and we're just trying to go through this life together. So typical day for me starts with waking up, getting the kids ready, which is a feat because I have a 4.5 to become 5-year-old soon, and I have a 10.5 to become 16-year-old soon. But of course, they don't have the urgency that, okay, mom needs to get out of the house. So that's my challenge, is getting out of the house. So once I get here, I drop the kids to school. I get here, I usually start off in the clinic. Some days I'm in the Echo Lab in the morning. On Mondays, I have the fellows conference where we teach them nuclear cardiac imaging, CT imaging. So usually in the evening, the day winds down, I actually get time to go back to my patient messages. So usually I'm here till probably between 5 and 6:37. I also do exercise. That's something that I try to stick to religiously. For the last 7 years, I've been actually doing boxing and kickboxing. You'd be very surprised that a lot of females and all ages, young, very young to very middle age, are there. And it's just very cathartic being able to, take it out on that punching bag, and also get your heart pumping and getting some exercise in. We try to do some outreach. We try to also take the kids to the park, and of course I go to my church every Sunday. So I definitely miss back home. It's different because life is simple there. I mean, you of course have the niceties and the technology there, but you can also unplug and just not look at your phone, not look at your computer, and just get back to just talking to people. And the food is awesome. That's without saying. Yeah, definitely.